So palliative care for children is inherently multidisciplinary. Anybody that tries to practice it by themselves, they're really not practicing palliative care. Palliative care takes a holistic approach, and in order to take a holistic approach, you have to have a holistic team, and that holistic team really needs to take an approach where we address issues related to suffering in general. In fact, I think a great way to think about palliative care is, if you think about oncology, the enemy is cancer. In palliative care, the enemy is suffering. So to think that as a physician I can address all areas of suffering is silly. I may be able to address some of the physical symptomatology that's causing suffering, but if you're thinking about psychosocial distress or spiritual and existential distress, or just psychological distress, or even holistic distress, or what we would call total pain or total distress, I could never do that by myself. That would be ridiculous to think, and quite actually complex to feel that I should be able to address all of those issues. The reality is we have to have a team approach that looks at all the different angles, and you take this holistic approach towards caring for this patient, but also for the family. Imagine being a sibling walking through this with their own sibling. That's critically important to address those issues. For the family as a whole, the reintegration into the community, how can we help them with that? How can we address those needs of that particular child, and discussing potentially end-of-life care with that child as well who is dying? That is really complex, and I could never do that myself as a physician. I've got to lean on the entirety of the team, maybe mobilize resources, maybe certainly help advocate for particular issues, but it has to be a team-based approach, and it really must be a multidisciplinary team.